Each year, 3 million older adults end up in the emergency room following a fall. Registered nurse Marie Dieter is a trauma program manager and vice chair of TraumaNet at Johns Hopkins Bayview, and Farheen Qureshi is a trauma attending surgeon at Sinai Hospital. Thank you so much for being with us.
Thank you for having me.
So these numbers are really staggering. A lot of people are ending up at the hospital. What are some of the injuries that you're seeing?
We are seeing quite a variety of different injuries. You can see anything from hip fractures, lower extremity fractures, even damage to the lung or the ribs. And sometimes most life-threatening, you can see bleeding around the brain.
And how do we know if someone is at risk for a fall? I think you really don't until they do.
So as we age, and looking at the age of over 65, our balance starts to change.
Okay.
And so with medications, our aging process, different disease processes such as diabetes. If you've had chemotherapy from cancer, you can have nerve damage. You will then be at risk of falling.
Be more prone to falling.
Yes.
And I was telling you guys off camera, I've had loved ones who are getting older, have fallen at home, and us as family members, we never saw it coming because they were fine just a week ago. And so that's one of the things, there are things around our houses that we should be aware of. And I think you brought some items so that we can sort of demonstrate. Okay, so walk me through what you brought here.
Okay, so we have a bunch of different activities that a lot of times physical therapists will use, and I want to mention one of the most important things for older adults and families is these are the kinds of things that can prepare you, so make sure you are talking to your doctor. A lot of times people won't mention that they're having this history of falls, so tell your doctor or your nurse so that you can get prepared like this.
Because if you're having a fall, it's not just one of those things that you had a fall and it'll never happen again, or you should dismiss it. You can prepare so that you don't keep falling.
Exactly.
Okay, great. All right, so what do we have?
So this is just a small step up.
This one here.
And so depending on where your balance is at that point in time, that may be your first step to beginning to just stepping up, stepping down, stepping up, stepping down,
and so
being able to...
It's got a little give there.
To work with your balance and improve your balance.
And this one I thought was a block, was not. So now we start
the
moving a little
difficulty
bit
is
more.
going up a little bit more. So this one wavers from side to side, and you can do this front ways, you can turn the other way, and just really to kind of get you used to balancing if you have any kind of slight difficulty at all or any give on the floor. It's really just a slightly bit more difficult than what we did just a second ago.
So, and then we progress here. I'm going to take your hand for this because I do not want to fall in a falling segment. But this one is something that they would do as well then.
Yes, and then this is the most difficult one that we've brought here. And it's not really even just about the difficulty, but just getting used to also how to fall, how to kind of gain or catch your balance. And we have, step-ups of difficulty. And like I said, these are things that your physical therapist can work with you on in addition to making sure that your home is safe.
So in addition to that, while you're up on the ball,
oh, should I stay up?
Yes, ma'am.
All right. See, I was so eager to get down.
In addition, what you do as you progress through each one of these steps, then we're going to add a little bit of difficulty.
Oh,
and
we're catching.
Throw a ball.
Not very well. Let's try that again.
Ball.
Oh, I think they're going to grab it again. Don't worry, they'll grab it. All right. So I was not prepared because I did not know that was coming, but that's the type of activity that you'd be able to practice at home with someone.
And so it helps you do more than one activity, and it also helps you then maintain your balance while you're on there.
And the hand-eye ball coordination that I do not have. Let's try it again. I swear I can catch it. Can I? Oh, yes. All right.
Yeah,
but you're right. But I had to practice with my balance to do it. See, I just need to know it was coming.
Core strength is very important for your balance.
Yes, it really is. And so you said that medication is also something that people should be on the lookout for because that can impact how you're balancing.
So if you're on a blood pressure medication, you can get dizzy when you stand up. Some medications that control your heart rate can also cause you to not have that normal response of when your heart increases when you stand up, and so that you can get dizzy.
And then, so we want to make sure that we are doing these activities to make sure that we can prevent falls. But if we have experienced a fall, what are the next steps? Just talking to our primary care doctor, or what should we be doing?
There's a couple of different things. Talking to your family, of course. As you know, as you mentioned, we were talking off camera about issues we've had with our family members.
Yes.
So it's important to mention it to them, and also to your primary care doctor, and to just try to be proactive so that you can do these types of practice things, but also at home, get prepared with maybe even going to the point of installing bars and things like that.
Yes.
But also just making sure area rugs and wires are out of your way.
And we've got a
that sort of
checklist as
thing.
well. So
Yes.
this is a checklist that people can do to reduce the risk of falling. So medical awareness, ambulatory aids, eye examinations, appropriate footwear, and then a home safety check. And then you two are also part of a team called TraumaNet. Tell us about that.
TraumaNet is the state advocacy group for the trauma system in Maryland. We take a look at injury prevention, systems issues, how we can work together as a state system in order to be able to address those issues, as well as legislation in the spring where when we take a look at ensuring that we still have helmet laws and those type of things.
Absolutely. And we can find out more information if you go to, or you actually want to visit maryland-traumanet.com. Thank you two so much for being here. And we'll be right back with more Midday Maryland right after this. Stay tuned.